This presentation is about giving report. We are going to explain S-bar. We are going to explain how to chart skillfully and efficiently. And this is written by Ivana Wilson, Libby Whitaker, and Tashika Tyrell.
Communication is very important between healthcare workers. When we are communicating in the health field, we always want to make sure that there are no medical errors. S-bar is a communication tool that was designed to help nurses communicate with other members of the health team, specifically doctors. S-bar is an acronym. The S stands for the situation, B stands for background, A stands for assessment, and the R stands for recommendation. So S-bar pretty much simplify what is going on with the patient and what the patient needs. It also helps the nurse to stay focused when communicating with the doctor. This helps to eliminate confusion, and it just gets straight to the point. It is important for nurses to do a full assessment of the patient before calling the physician. Nurses should always collect vitals, check pain levels, check for any wounds, and neurological changes. Nurses should always review their chart. Be aware of any diagnosis and any most recent treatment. It is also important for nurses to know the admitting diagnosis. When speaking with the doctor, nurses should always have the chart, allergies, meds, IV fluids, and any labs results available. It is also very important that nurses read the most recent progresses note and assessment from the nurse of the prior shift.
The S in S-bar stands for situation. So when you are calling a physician or another healthcare provider, you want to be sure to first identify yourself. Let them know your name, your position, and the unit you are working on. So for example, I may call and say, "Hi, this is Ivana calling from the PECU. I am the nurse giving care for such and such patient in room 123. So you want to be sure to identify yourself, the unit that you are on, but also identify the patient's name and their room number. After you have identified yourself and the patient, you also want to identify the specific problem that you are calling to address. When you are giving a background to a provider or any other health professional, you want to be sure to review the admission. You want to state the date of the admission. Also include the admission diagnosis. Include any pertinent facts that were gathered during the admission process. You also want to review medical history. Any past medical history that is related to the diagnosis or the problem that you are calling about. You also want to give a clear summary of treatment that the patient has received between admission and this current point. You want to be very clear on the things that have been done, the interventions that have already been given when you are speaking to the provider. When you are communicating your assessment to the provider, you want to be sure to include the most recent vital signs. So you should have gotten vital signs before you call the provider. You want to make sure you communicate the patient's blood pressure, pulse, respirations, temperature, and also their pain level. You want to note things like if the patient is on oxygen or not. Do they have any other assistive devices? Are there any changes in their vital signs, their pain, wound status, mobility? You want to be sure to note anything that has changed about the patient. Think about documenting by exception when you are communicating changes in the patient. Anything that is different out of the norm should definitely be communicated to the physician.
On this slide, we talk about recommendation. So essentially, when we talk about recommendation, we want to state what we would like to see done with our patient. So does our patient need to be transferred somewhere? Does the patient need to be seen by the physician immediately? Do we need to talk to the patient's family about anything? And just kind of overall what we would like to see done with this patient, and make sure that any tests are ordered that they need to have ordered, and things like that. And then with recommendation, we also need to ensure that we understand the next steps of their care. So this could mean, how often does the physician want us to take their vitals? Does the physician want us to follow up? A few charting key points that we added here is to ensure that every action that you do is charted immediately after it's done. So if I give a patient a medication, I need to document that. I don't need to wait an hour and then go back and chart it, because that could lead to errors. So a few other things, we need to chart allergies, medications, IV fluids, and labs. We also need to make sure that we're using appropriate nursing diagnoses, and we need to make sure that all of our abbreviations are correct as well. The last thing that we have included about key points with charting is that all data is relevant and correct. So we need to make sure that all data in regard to our patient is relevant and correct. Some tips for charting that we have included is to chart objectively with clear findings. When we do this, it shows the patient situation and also the progress of their care. Calls and communication should be documented, so whoever you're talking to on the healthcare team, it needs to be documented and in the patient's chart, along with the time and date and who you spoke to. We also want to chart areas of risk for hospitalization. So this could include age, infection, nutrition status, previous hospitalizations, and their community around them. So we can ask ourselves, do they have a support system? Is their wife or husband there? And things like that. We also want to include assessment, care planning, interventions and actions, and results of patient education. So kind of everything that we're talking about with this PowerPoint, it all needs to be included in the chart. We also want to include patient needs, goals, and the discharge plan. So everything that's relevant to the patient should be charted, and to ensure that we are giving the best patient-centered care possible.
Here is a slide with the references that we used. The most important thing that I want you guys to remember from this presentation is that it is very important for us to be able to communicate efficiently and effectively. Communication should be uniform across disciplines, because we want to ensure that not only is our care patient-centered, but we are also providing adequate care to the patient. We want to avoid mistakes. We do not want the patient to incur any additional diagnoses while they are under our care. And we also want everyone on the healthcare team to be on the same page. We want everyone to have a clear-cut understanding of the patient's condition and the treatment plan. Our entire goal here is for the patient to receive healing and rehabilitation, and whatever that looks like for that patient. We want to make sure that when we are communicating to other people on the healthcare team, that they know and understand 100% what we are saying about the patient. We also want to make sure that we are following all guidelines. NANDA has set specific guidelines for how we create nursing diagnoses. This is very important because all healthcare professionals should be abreast on the most recent research that is out there, which means we should all have a baseline understanding of the types of communication that we need when communicating with each other about patients. Again, very, very important for us to make sure that the communication is clear, it is concise, It is direct and straight to the point, and it is also being understood by every team member that is providing care to our patients.